today I'm going to talk about cystic acne. This is a type of acne that's really uncomfortable to deal with, and a lot of you ask me for skincare product recommendations that are suitable for cystic acne. So I thought I would address some of your questions in today's video. Acne is a skin disease that's very common, and there are a few different skin lesions that constitute acne. There are what are called open and closed comedones, which are commonly referred to as blackheads and whiteheads. I have videos on both topics, so if your acne is primarily comedonal, check out those videos. I go into more of the specifics there. Also, there can be red, juicy papules or bumps. And then in the case of nodulocystic acne or cystic acne, there are lesions that are either cysts or nodules or kind of a combination of the two. And cystic acne or nodulocystic acne is a type of acne that will scar if left untreated. And unfortunately, the stuff in the drugstore, things that you can buy over the counter, things that you may be using in your skincare routine, while they may be helpful, they are usually, in fact, never enough to treat the cystic acne. It requires you to see a dermatologist for evaluation and management, as there are specific prescription medications that are indicated. And the reason that's super important is that nodulocystic acne will go on to scar, and that is something that you want to prevent. A scar, a true acne scar, leaves behind a divot in the skin, and that cannot be repaired for the most part. There are some cosmetic procedures down the road that can improve the appearance of an acne scar, but there's really nothing that will take a true acne scar away. And so prevention is key. Cysts, by definition, are deep within the skin, and they are almost like a sac around a hair follicle. Initially, they fill up with blood as part of the acne process. They become very inflamed, and then later that turns into pus. And that cyst can rupture under the skin, and when it ruptures, that disrupts the deeper layers of the skin and causes scarring. A nodule, by definition, is a skin lesion that you can see that's like a bump within the skin, and you can almost put your fingers around it. It has more dimension to it. And a nodule is greater than a centimeter, and it is typically deep down within the skin as well. And both of these types of lesions can go on to scar because they are deeper down under the surface of the skin. And they stay around for a long time, weeks to months. And as I indicated in the beginning of the video, they're very uncomfortable and be very painful. And these lesions, cysts and nodules or nodulocystic acne, these are lesions that you may want to try and manipulate or squeeze, but you'll notice that you really can't. And in fact, you absolutely should not, because any kind of squeezing or manipulating of the cysts and nodules of nodulocystic acne definitely will accelerate the progression to inflammation and scarring. So it's definitely something that you want to resist the temptation to do anything to, and instead, try and see a dermatologist as soon as you're able. You can think of a nodule as basically when the pore kind of ruptures under the skin and it leaves this messy bump that you can feel. Whereas a cyst is what happens when the pore becomes so plugged up that everything beneath the pore within the follicle kind of swells up and gets filled with pus, dead skin cells, and some of the bacteria that contribute to acne. And your body tries to wall that off within the pore. So why do people get nodulocystic acne? Well, there are several factors that go into play in nodulocystic acne. First of all, your genetics, which unfortunately you cannot change. The pathogenesis of nodulocystic acne involves a few components. First of all is oil production or sebum production in the pore. And that is governed by things like your gender. Males make more oil than females do. And again, your genetics. as well as hormonal influences, whether it be hormonal changes that occur with pregnancy, with breastfeeding, with starting and stopping birth control pills, or around the time of menopause, or hormonal factors due to a condition called polycystic ovarian syndrome. All of these things can influence the rate of oil production in the pore. And the other type of hormonal signaling that definitely can drive oil production and exacerbate acne, I'm sure everyone has experienced this at some point in their life, is stress. Stress makes everything worse, and if you have a predisposition to acne, you may notice that it flares when you become particularly stressed out, or say you get sick and your body is taxed and overstressed. Then that is a situation where it's not uncommon for acne to flare. The other key aspect of acne pathogenesis is going to be inflammation in the skin. So inflammation can come from a few sources. If your skin is too dry and it starts to lose water, it can compensate by becoming inflamed and irritated, and that can drive more oil production and more inflammation into the skin. And also, inflammation in the skin can be heightened and increased by manipulating your skin, whether it be through picking or squeezing or trying to use an extractor, or the skincare products that you're using may just be too harsh and irritating and are pushing your acne in the wrong direction. In addition to inflammation, there's also a little bacterial component in the pathogenesis of acne. I already alluded to this. Propionibacterium acnes, or Cutibacterium acnes. That bacteria is a normal part of everyone's skin, but within the pore, it can proliferate too much or divide too much, become too comfortable, and then as it breaks things down in the pore, that creates an inflammatory mix of factors that drive acne. And then another important part of acne pathogenesis is the cells that line the pore. For whatever reason, they don't divide in a normal rate, and they kind of get glommed up in there and plug up the pore, and that can drive acne for sure. If you have nodulocystic acne, it's really important to see a dermatologist because, as I said in the beginning of the video, this type of acne will scar without treatment. And the other reason that it's important to see a dermatologist is that nodulocystic acne typically takes a long time to go away. It doesn't go away in a few weeks, like maybe comedonal acne can improve in a few weeks. Nodulocystic acne will not budge after just a few weeks of trying things over the counter. So the other thing you have to think about when you have a big nodule or a big cyst on your face that's not going away, particularly if you are an older adult, is there is also the concern that it might be a skin cancer. If you'll recall from my videos on basal cell carcinoma and melanoma, some skin cancers can look an awful lot like a pimple that won't go away. So you certainly don't want to be missing a skin cancer. So very important to see your dermatologist. And then through history taking and physical exam, then they can develop a treatment plan that's most appropriate for your acne. What kinds of treatments are offered? Well, at the time of getting a cyst or a nodule, the dermatologist might offer to inject it with a corticosteroid. This will help to shrink it down, reduce the inflammation, and prevent it from going on to form a scar. Side effects or risks with having the cyst or nodule injected with steroids is that sometimes it can leave behind a divot in the skin if not done properly, and it can also leave behind a discolored spot on the surface of the skin. It can take away the color of the skin. That tends to not be permanent, and eventually the color will return, but it is a potential risk. But when done correctly, it can be a very helpful intervention at preventing that particular lesion from going on to scarring. The other thing that can be done in the acute setting, just to clear up what you have in an effort to prevent it from going on to scarring, is to prescribe a course of an oral antibiotic. Oral antibiotics like tetracyclines are not only going to be helpful for addressing the bacterial component of the acne, but they're also anti-inflammatory. Common oral antibiotics that are prescribed include minocycline or tetracycline or doxycycline. And the goal is never to keep you on these oral antibiotics long term. They're merely prescribed to prevent the existing acne that you have on your face from going on to scarring. Medications that may be started for maintenance include prescription topical retinoids like tretinoin. That can actually be helpful long-term in controlling some of the acne. It's often not enough by itself, but that often will be started. And then another medication that may be considered, particularly in the situation where a major component of your nodulous cystic acne is hormonal, is, if you're a female, an oral birth control pill. Can be incredibly helpful at balancing out the hormones that contribute to increased sebum production and acne. Not only oral birth control pills, but also another medication called spironolactone. It can likewise influence some of the hormonal signaling that drives acne, and the combination of an oral birth control pill with spironolactone in women oftentimes can give them very good control of their acne because it addresses that hormonal component. I have a video talking about spironolactone, so check that out. I go into detail about how it works, the side effects, and as you'll recall from that video, unfortunately spironolactone does have to be stopped when you are considering becoming pregnant and during pregnancy because it is not safe during pregnancy. But otherwise, it's a great medication for this, and particularly in combination with birth control pills, it actually can really hit multiple arms of the hormonal signaling part of the acne. Then the other medication that you may be wondering about for nodulous cystic acne, particularly in adults, is isotretinoin or Accutane. This is an oral retinoid medication that is taken for many months and can definitely help get the acne under control. And after stopping the medication, it continues to impart control. I have a video talking about Accutane, so check that out if you are at all curious. I talk about the side effects in that video. But overall, it can be a very effective medication for nodulous cystic acne in adults, and it's really good in teenage boys. For whatever reason, tend to do the best on Accutane, but it can be incredibly helpful as well for nodulous cystic acne in adults. It's another option. If your acne, however, is more hormonal, Accutane can help, but it doesn't often help that much. The main thing that really will help is addressing the hormonal component, either with a birth control pill or spironolactone. But sometimes Accutane too does help in those situations. It's nuanced, and who's going to respond to a particular treatment regimen versus not is actually kind of hard to predict sometimes. Another treatment that may be offered is light therapy. Blue light therapy can reduce the bacteria in the skin that contribute to acne, Propionibacterium acnes. And red light therapy can calm down inflammation in the skin. So the combination, or one or the other, can be offered, and it can actually be really helpful. And the great thing about blue and red light therapy is that they are safe during pregnancy. Unfortunately, during pregnancy, many of the medications that we use in acne have to be stopped, and it can get much worse. So blue and red light are an option. So that's what I can tell you about nodulous cystic acne. I hope it was helpful. It's an incredibly uncomfortable and painful type of acne to cope with, and given the risk of scarring, it really has profound impact on your self-esteem. Please see a dermatologist. We definitely can help, and this is our specialty. And the last thing you want is for your acne to scar. And stuff that you can get over the counter, the common acne medications that I've talked about in other videos, Differin, salicylic acid, benzoyl peroxide, sulfur. These things may be helpful, but it's important for you to know they are not going to be enough to treat true nodulous cystic acne. It requires other prescription medications. What you can get over the counter is not going to be enough. And so don't attempt to treat your own cystic acne with stuff over the counter. If anything, what you might end up doing is causing a lot of irritation that will ultimately worsen the acne. So it's a tough disease to cope with. I hope this video was helpful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.